Hello and welcome to week 10 of PA114. We are in the final week and you guys are almost done, which is awesome. So we are in chapter 24 as well, so we need to do this before we take our final exam, so I wanted to lecture about it to you. Chapter 24, we're talking about emergency drugs, IV fluids, and blood products. So we're talking about the routes of administration for emergency drugs is usually an IV route. Does anyone know why you would do an IV route? It's because it's the fastest way to get into your bloodstream. IV push produces a maximum drug effect in the shortest period of time. It's successful. Continuous IV drip infusion is used, and the IV route is by far the most common route of administering emergency drugs. They also do endotracheal route, meaning through your trach, and so that is with some certain drugs and right into your lungs, depending on what type of drug it is. And then they have intracardiac route, intra meaning into, cardiac meaning heart, so into the heart. It's not used frequently but can be valuable when other routes have failed to produce a therapeutic effect. And remember, when we're talking about therapeutic effect and side effect, how much different they are. Therapeutic effect is what the drug is doing for good, and the side effect is what comes after it when it isn't, can be not for good. They go into talking about asystole, meaning arrhythmias, and asystole, meaning what type of thing is it doing for the heart and stimulating the heart. And so those type of things you can look at. And here's something I want to talk about here. Drugs used to treat a drug overdose, suicide attempt, or accidental poisoning. This can be really important for the health professionals to know in the ER. If they're trying to treat you and they don't know what type of medication you took, or nobody does, it's really hard for them to know if they're going to give you a drug that will interact with the drug that you took. And so I want to read a little bit about that. It says, any drug or substance, when ingested in large amounts, can be toxic and fatal. Treatment consists of removing the drug from the stomach, binding the ingested drug to another substance to make it inert, meaning like with kids, if they've taken Drano or something like that, they'll give them charcoal to make them throw up, and the charcoal actually will bind to the medication or bind to the toxic in their system, and so it'll take it out of their bloodstream quicker. And or inactivating the drug in the blood. So an emetic drug is helped to induce vomiting. So this is like Ipecac syrup, and sometimes grandmas will tell you all the time they have to have that around. They don't have that as much anymore, and I don't think a lot of people have them on hand. I don't, but I don't know, and I think the pharmacy does sell it. But it is helpful if it has been an overdose drug. Absorbent drug, this is the activated charcoal like we were talking about. The narcotic antagonist drug. So an overdose on narcotic drug can be reversed by giving a narcotic antagonist or blocker drug intravenously. Narcotic antagonist drugs compete for the same receptor sites as the narcotic drug, blocking those receptors and decreasing the narcotic drug's effect of unconsciousness, respiratory depression, and hypotension. So if you have learned about narcotic medications and the side effects, and these are some of the side effects, is it makes you very sleepy, it can decrease your heart rate, it can make you unconscious, decrease your breathing, and so it will do that even if you do take a small amount of dose. If you overdose, it can actually make you stop breathing. It can stop your heart. And so this is what an antagonist drug will do. It'll help block those receptor sites so that it won't cause those side effects, which could kill you. Then they have the tranquilizer antagonist drugs, antidepressant antagonist drugs, and other drugs for overdose is listed here. The drug is used to treat an overdose of the cardiac drug digoxin because the digoxin's low therapeutic index, narrow margin between the therapeutic dose and the toxic dose, and its long half-life, it is not common for elderly patients to experience digoxin toxicity. And so they can give this to treat like an Tylenol overdose. It protects the liver and the main side of symptoms from acetaminophen overdose. So let's break that down. So we've talked about digoxin. It is a cardiovascular drug, and I think we just talked about this last week. Cardiovascular drug that helps to rid any excess fluid from your body. So any excess pressure that it might be causing, and that kind of thing. And so, okay, sorry, I had to plug in my computer. So let's talk through this. Digoxin is that water pill. And it is very hard to overdose on that water pill. It will get rid of a lot of water, but it's not very toxic. But if someone has taken Tylenol, remember, Tylenol affects anything that we've done in our liver, or can affect our liver, because everything is processed. This drug is processed through our liver. And so if someone has taken too much Tylenol, they can give them digoxin to help just wash it out of your system very quickly. Remember that the water pill can only be taken in the morning because it could cause urination, excess urination. This is a good thing when you've had an overdose of Tylenol. It just goes to show that the side effects can actually be a therapeutic benefit in the end to some other drugs if it's treated as an overdose drug. I just think it's so interesting, the science of these medications, that you can really look into it. Did you know, because I think that you would see a lot of this, sometimes an alcoholic patient will drink methanol instead of ethanol, liquor in the body. In the body, methanol is metabolized into formaldehyde, a toxic chemical that is used by pathologists to preserve tissues because, excuse me, ooh, I almost dropped you. They don't have any money to buy the methanol, so they'll start taking, they don't have any money to buy ethanol, so they'll start taking methanol, which is that the alcohol used to like treat if you've got a injury or like a scratch. It's used to wash out the wounds. So methylene blue is a dye that is used to stain tissue samples, and it is used during surgery to stain tissue that is abnormal so that it can be excised. It is also an antiseptic drug that is included in many combination drugs to treat urinary tract infection. It's just really interesting to see how these different drugs are treated. Sorry, I need to change. The other type of emergency drug that we need to talk about is the EpiPen. EpiPens are used when there's an allergic reaction. And most people who have anaphylactic shock are prone to that, like if they're allergic to peanuts or they have asthma, if they have allergies and they've been given medications to take medications, so then they need to take an EpiPen to have that with them at all times. That is something that we dispense all the time in the pharmacy. So I think that pretty much sums it up. Talks about normal saline, total parenteral nutrition, TPN. This is something that you'll need to know if you are a hospital pharmacy technician. TPN is given to patients who cannot take food by mouth, and so it is dextrose and electrolytes, intravenous fluids that is pushed so that the patient can still have proper nutrition. And kind of goes into some of the plasma proteins and albumin, that kind of stuff. So there are some questions on the exam about chapter 24, so make sure that you do read that before you take your final exam. Good luck in taking it. Make sure that you give yourself enough time to do that. And if you have any questions before, make sure that you review all the chapters that we've studied in PA114, because they are all fair game for final exam, not just to week 5, but all of them. And you can use your book, so please do that. But make sure that you know where to go so that you're not flipping back and forth and not knowing where things are. Anyway, if you have any questions, let me know, and I would be happy to answer them. Otherwise, good luck, and make sure that everything is in to me by Thursday at midnight. Have a good night.